Hello, hi. My name is Mohammed Badaway. I am a senior at Herzing University. I am about to give a presentation for week 7 on mental health. This is the topic I chose for my call for legislation, my proposal, and this is what I found of importance to me. A little bit of background about me. I'm a emergency room nurse. I've been a nurse for close to 2 years now, and I only have experience in the emergency room. I wouldn't want it any other way. I love the emergency room. It's very fast paced. I feel like it's very beneficial for males who like the fast paced environment as compared to a med surg or ICU unit that's kind of more at a steady rate. I feel like for young males like myself, it's very to our liking to have that kind of fast paced environment that you can kind of relate to. So, as a emergency room nurse, we see everything. One thing lately I've been seeing, and that's why I chose this topic, is a lot of psych patients who struggle with their mental health. So we get a lot of psych patients, but we don't have a psych facility in the hospital I currently work at. So a lot of the times when we get these psych patients, they just kind of sit until we find them a facility to transfer to. And since the whole COVID protocol and all that stuff that's going on now with the pandemic, it's a lot easier said than done to find people placement, to find people, you know, accepting facilities. So a lot of times they just wait. One thing I've noticed is a lot of these people that just sit around and wait, they start to lose it because they're in a place for such a long time, and food's not good. There's not much they can do. There's nothing on TV. They don't they feel like they're in prison because they're kind of just trapped in somewhere. So a lot of them, maybe they come in calm, maybe they already come in combative, but a lot of the times it's like their state deteriorates because of what is going on and because they're not getting help, because they're just kind of sitting around. They start to lose it. And not to give them a blanket, but sometimes I understand it could be frustrating to be somewhere for so long and then you feel like nothing's getting done and you're just waiting for somebody to accept you. It's like, hey, here I am, don't forget about me. Oftentimes, because we're in an emergency room, we always think life first. So I feel bad too because I'm a victim of this myself. We don't necessarily forget about them, but they become like at the bottom of the ladder because you focus on your ABCs, your airway, breathing clearance. So you'll go assess somebody who has difficulty with their breathing or somebody in chest pain, and you'll kind of forget, or you'll subconsciously just neglect your psych patient who also needed something. And sometimes it could just be a simple request. Maybe you forgot to get them water and they've been waiting around now for an hour without water. Like, hey, am I not important? That's something to keep in mind. So, kicking this off, like I said, I just give you guys a little brief overview on mental health and the effect that it has. It really has an effect on how we interact with people, how we are with one another, the choices we make in our everyday life. All throughout lifespan, your mental health is important. So it's not just like a geriatric issue. It's not just a adolescent issue or a child issue. It's all through our lifespan that you're prone to struggle with mental health, that it's of importance. It's always important to keep mental health in mind. There are mental disorders that can develop from struggling with your mental health, such as schizophrenia, manic phase, bipolar disorder. The list goes on and on. Some of these can be overcome. Some of them can be life lasting. Some of them, like I said, they can be dealt with accordingly, but that's why it's important to cope with your mental health. That's why it's important to address it. I researched an article and it pointed out that more than half of Americans will be diagnosed with a mental health disorder at some point in their life. That's a big number to keep in mind. Your mental health can also affect your physical health. I had a family member who did not address their mental health accordingly. Their mental health kind of kept deteriorating, and then they started suffering from issues such as stroke, and he started having some cardiac issues as well. your mental health is important because it can help you realize your full potential. Oftentimes, you see people, they don't reach their peak or their full potential because they're so down on themselves. If you have a positive mindset, it can make you realize how important you really are to this world. Another important thing to look out for is mental health can help you contribute positively to your community. Being able to give back to your community helps better your environment. So, but being mentally strong plays a big role in that because you have to believe in yourself. Like I talked about earlier, you have to believe in yourself to believe in other people. If you're down on yourself, you're going to be down in general. Nobody likes a negative Nancy. So, some factors that contribute to mental health include a person's experiences and their traumas. People that have gone through a lot are going to struggle with their mental health. People, because they've been through such difficult obstacles, people have seen war, they've dealt with breakups, divorces, such and such. It's going to take its toll on them, both physically and mentally. That ties into your family history too. If you have parents that struggle with mental health, there's a higher chance that you're gonna also struggle with your mental health, because if they're taking their anger out on you, you're gonna feel down on yourself. You're gonna feel less of an individual yourself. Another factor to look out for is someone's lifestyle. If someone just kind of quickly goes from being happy and positive to being withdrawn, lethargic, and just kind of out of sync, that's kind of a red flag. That's somebody you might want to check up on. If they're just not wanting to deal with you, or if you're normally interacting with them and now they're just kind of like pushing you away, that might be a red flag that you want to look out for. Some signs to look out for include a change in daily tasks, like I talked about earlier. For example, somebody who doesn't take care of their house anymore. Normally they're a neat freak. Somebody who claims that they're hearing voices. Somebody who's changing their eating habits. Somebody that changes their sleeping habits. Somebody who wants to harm themselves. Somebody wants to harm somebody else. Mood swings. Somebody that feels helpless or lonely. Somebody that feels depressed. Oftentimes, people will open up to you like a book. A lot of people do hide how they feel, but plenty of times people will tell you straight up how they feel, and if they do, that's something to jump on. A call for action that I talked about would be to promote maybe more psychology majors. This way people are more educated on the psychology that ties into mental health. And so not everybody's going to want to be a psychology major. One thing to maybe throw in there as an incentive is like 15% off of tuition. That's something that you could talk about at the college level and bring it up to the government. This way both parties kind of benefit. Another thing I would want to go for legislation to call for action would be to have more clinics available. A lot of times when I talk to patients, they say, there's only X amount of clinics available to me, and the ones that are there that will accept me, I have to wait 5 months for an appointment. That's almost half a year. So somebody that wants help, more than likely they want help now, obviously they want help in the future too, but they need to be assessed and evaluated now. For them to wait 5 months just makes them feel like, what am I going to sit here around waiting for? Am I not important? Why is it, let's be real, not everybody wants to wait such and such time. Not everybody's as patient as I might be, or you might be, or that next person might be. If they're struggling now, they need help now. So having more clinics available will open up more times. This way people aren't waiting as long. And a very important piece I put in my presentation would be to hold seminars at workplaces and at schools. So have seminars to where you could talk about mental health options, treatment options, resources that are available. I would want to go to, for example, hospitals, engineering plants, grocery stores, these people that might be struggling with mental health. This way you can educate them, they can educate their family members. And even more importantly, I would want to go to the schools, all levels, elementary, middle school, and high school. I would want to go to each level of schooling and provide same thing education on mental health, when to seek help, when is the right time to look for help, when somebody might be struggling with mental health, and what are your options, what are the resources available, and what are treatment options. This way people are at least aware of mental health. At least it gives them better sense of opening up. This way, they don't want to, you don't want to shy them away. You want to bring them in. You want them to be able to open up to you. That's kind of my piece. That's a call for action that I would want. I would bring that to legislation. I would try to bring that to legislation. I would let them know the importance of doing so. If there's any questions, I'm more than free to answer as my presentation, and that wraps that up for today.